Intro. Hey everyone, welcome back to our channel. Today, we're going to discuss a topic that is of utmost importance, especially for parents with young children: respiratory infections. Children are particularly susceptible to respiratory infections, such as colds, flu, bronchitis, and pneumonia, and these infections can be caused by viruses or bacteria. In this video, we'll discuss everything you need to know about respiratory infections in children, including their causes, symptoms, prevention, and treatment. Chapter 1. What are respiratory infections? To begin with, let's talk about what respiratory infections actually are. Respiratory infections are infections that affect the respiratory system, which includes the nose, throat, bronchi, and lungs. There are different types of respiratory infections, including the common cold, flu, bronchitis, and pneumonia, among others. In children, these infections can cause a range of symptoms, including coughing, sneezing, congestion, fever, and difficulty breathing. Chapter 2. Causes of respiratory infections. Now that we know what respiratory infections are, let's discuss their causes. Most respiratory infections are caused by viruses, such as the rhinovirus or influenza virus. However, some respiratory infections can also be caused by bacteria, such as Streptococcus pneumoniae. These viruses and bacteria can spread through the air when someone with the infection coughs or sneezes, or by touching a contaminated surface and then touching the nose, mouth, or eyes. Chapter 3. Symptoms of respiratory infections in children. One of the biggest concerns for parents when it comes to respiratory infections is identifying the symptoms. Symptoms of respiratory infections in children can vary depending on the type of infection, but common symptoms include coughing, sneezing, congestion, fever, and difficulty breathing. In some cases, respiratory infections can also cause ear infections, sinus infections, and other complications. Chapter 4. Prevention of respiratory infections in children. Prevention is always better than cure, so in this chapter, we'll discuss the measures parents can take to prevent respiratory infections in their children. Good hygiene practices, such as washing hands frequently and avoiding close contact with sick people, are essential in preventing the spread of respiratory infections. Additionally, getting vaccinated against the flu and pneumococcal bacteria can help reduce the risk of respiratory infections. Chapter 5. Treatment of respiratory infections in children. If your child does develop a respiratory infection, it's important to know what treatment options are available. Most respiratory infections in children are viral and will clear up on their own with time. However, antibiotics may be prescribed for bacterial infections such as pneumonia. Treatment options for the symptoms of respiratory infections include over-the-counter medications such as acetaminophen or ibuprofen, as well as home remedies like humidifiers and steam therapy. Chapter 6. Complications of respiratory infections in children. Although most respiratory infections in children are mild and clear up on their own, there are some complications that parents should be aware of. These complications can include ear infections, sinus infections, and pneumonia, which can be serious if left untreated. In some cases, respiratory infections can also exacerbate underlying health conditions like asthma. Chapter 7. When to seek medical attention for respiratory infections in children. Parents should be aware of warning signs that may indicate a more serious respiratory infection and require medical attention. These warning signs include difficulty breathing, high fever, severe coughing, and dehydration. It's important for parents to know when it's appropriate to see a doctor and seek medical attention for their child's respiratory infection. Chapter 8. Coping with respiratory infections in children. Having a sick child can be stressful for parents, so in this chapter, we'll discuss coping mechanisms for parents dealing with respiratory infections in their children. It's important for parents to take care of themselves, too, by getting enough sleep, eating well, and seeking support from family and friends. Parents can also help their children feel more comfortable by providing plenty of fluids, rest, and comfort measures like humidifiers or warm compresses. Chapter 9. Conclusion. In conclusion, respiratory infections are a common concern for parents with young children, but there are steps that can be taken to prevent and treat these infections. Good hygiene practices, vaccination, and seeking medical attention when necessary can all help reduce the risk of respiratory infections and their complications. If your child does develop a respiratory infection, rest, hydration, and over-the-counter medications can help alleviate symptoms. Remember, it's important for parents to take care of themselves and seek support when needed. That's it for today's video on respiratory infections in children. We hope you found this information helpful and informative. If you have any questions or comments, please leave them down below in the comment section. And as always, don't forget to subscribe to our channel for more videos on health and wellness. Thank you for watching.